Let's talk about these plastic surgery centers. We hear their commercials all the time on the radio. Plastic surgery has traditionally been a specialty of solo practitioners or small group partnerships. The vast majority of plastic surgeons around the country own and operate their own practices. These doctors are able to make all the decisions that are important in maximizing patient safety and results. A doctor who owns his own practice decides what patients will be told, which patients they will want to see, which patients they will operate on, and where they will do the surgery. They will decide the type of anesthesia and which anesthesiologist they will use. Now, South Florida is one of the hotbeds of plastic surgery around the country. As a result, plastic surgery centers have opened up that are owned and operated by businessmen whose primary goal is to make money. They have no medical background. So how do they recruit doctors? Well, there are more plastic surgeons here in South Florida per capita than anywhere else in the country, which makes it very competitive for plastic surgeons. There are some plastic surgeons that could not make it in private practice who are just out of training and happy to find a job here. These doctors are hired by businessmen who own these cosmetic surgery centers. The business owners control the business. They make the decisions on which patients will be seen, how much they will be charged, which surgeons will operate on which patients, how many surgeries the surgeons will do on a given day, where the surgery will be done, what kind of safety equipment is or is not available, etc. In return, the surgeon doesn't have to deal with administrative issues, but they only get paid a small percentage of the fees, perhaps as little as 10 or 20% of the total fee. As a result of this arrangement, the surgeon feels less responsibility for any particular patient, and the primary incentive is to do as many surgeries as quickly as possible to be able to make a decent salary. In other words, as the owner of my practice, what I will earn from one surgery, these doctors have to do 5 of the same surgery to make the same amount. Now, this is not to say these are all bad surgeons per se, although there are many with countless lawsuits. But the way the business is arranged is not conducive to them doing a good job consistently. They may in fact be board certified, and they may have many years of experience, and I am sure they have many satisfied patients. But why would you take the chance? Do you want to be the 5th or the 7th surgery of the day, or even the 1st, knowing that the surgeon is in a hurry because he has 5 more patients after you? Don't you want to be sure the surgeon who is going to do your surgery, has time to spend with you before the surgery to explain everything to you, and will be available afterwards to make sure you are healing correctly? Don't you want the surgeon who does your consultation to be the same surgeon who does your surgery? Believe it or not, it's not always the case. In some cases, there are medical assistants who perform part of the procedure to make it go faster. They're not going to tell you this. Since I rely heavily on patient referrals, I have an incentive to do a great job on every single patient and be available for them for whatever they may need during their recovery. On the other hand, because these business owners spend hundreds of thousands or even millions of dollars advertising to get new patients, the doctors who work at these centers actually have very little incentive to make sure their patients are happy. After all, the next day there's going to be 5 more patients waiting for them. When patients come back with complaints, the owners give them the runaround. The doctors are either not around, or they cancel their appointments, or they are seen by other doctors who have even less interest in fixing whatever problem they have. No one wants to take responsibility, and they just hope the patient goes away. In some cases, with a persistent patient, they will settle with them to avoid more lawsuits. And believe me, these centers have countless lawsuits and even multiple patient deaths. They are set up to make the most amount of money, while patient safety and satisfaction are an afterthought. Patients are lured in by cheap prices and misleading ads and aren't educated on exactly what they are about to experience. As just one example, there is a commercial that advertises breast augmentation for a fairly low price. What the ads don't tell you is that it's a procedure done under local anesthesia. No one in their right mind would have a breast augmentation done under local anesthesia, but they don't tell you this. They make it seem like it's perfectly normal when no other surgeon in the country does this. They take your money, they perform this barbaric procedure on poor unsuspecting women. After being in practice for many years here in South Florida, myself and many of my colleagues have seen countless unfortunate patients who have had surgery at these centers who are looking to have corrective surgery and have shared with us their horror stories. Unfortunately, with good lawyers and lots of money, these centers are able to stay open to the detriment of thousands of unlucky patients who didn't do their research or were simply fooled and/or lied to. Hopefully this video has enlightened you a bit on the truth behind these centers, and you will know to stay far away from them in spite of their low prices. Best of luck to you.